All right, let's go ahead and dive deep into some research studies talking about weightlifting for women at risk for breast cancer related lymphedema. This is either a question I get or a comment I hear. The question being, can I lift weights after lymph node removal? And then the comment I get to hear all the time is, I'm at risk for lymphedema. My oncologist told me I should not lift weights. So let's see what the research shows and let's dive deep into it. Okay. Now, this I have not read this, by the way. Obviously I know what the research says in general, but I don't know what when I say that I mean like broad, what we know from science. Let's put it that way. I have no idea what this specific research trial says. I am hoping that this is still recording. I'm going to go back and forth here just to make sure that it's still recording. We are good. And let's continue. Okay, so who are the authors? So Catherine Schmidt. So fun fact, I actually got to meet Catherine. She would have no idea who I am, by the way. I actually worked with her on a bigger trial. It was basically a study where a bunch of different universities and a bunch of different research centers got together and we were looking at one common goal of, is exercise during treatment effective? And every place had a different research that they were doing. Catherine Schmidt was looking at a certain type of exercise in a certain type of cancer, and then different other researchers were doing different things. I got to do an overview of what she did. I don't remember the trial, to be honest. It was like 3 years ago. And we were in a big conference call, so I got to, at least hear from her, talk to her. She's pretty fun, pretty down to earth. And I think I got to meet her wife as well. I think she was in the call. I don't remember if she was or wasn't. I remember her sharing that, that was her. So I think her wife actually ended up having cancer, stage 3. I don't remember what it was. Um, and that's part of the reason why she's very passionate about this topic. So, anyways, anytime you see Catherine Schmidt, I hope I'm pronouncing that correctly. She's a big time researcher in exercise oncology space. Um, Down to earth and fun to talk to. Yeah, pretty big name. Once again, I haven't really checked this out. I don't know. I mean, I'll read the abstract when I get an idea of what topic I want to read, but I already kind of know. I did not read it beforehand, so I literally have no idea what it says. I kind of just look for anything that's free that I can read on the internet, and sometimes I'll just view the results. This is more, or sometimes I'll just view the methods. I don't even know what the results are on this one. I just saw Catherine Smith, and um, let's get into it. This is 2010. So even though it's, what is it? Today's 2026. So that's 16 years ago. All right. So more than 2.4 million breast cancer survivors live in the United States. Lymphedema ranks high among their concerns because it causes swelling and discomfort, impaired arm function, and quality of life. Actually, this is one of the biggest concerns I had in the medical field. So when I used to work at the University of Miami, I saw patients, pre, post, during cancer treatment, the whole spectrum. And one of the concerns was, the risk of lymphedema. Now, many cancer survivors don't know that they can actually reduce their risk, and they also don't know that they can help manage it through exercise. So this is a conversation I had to have all the time. But it is a common concern, risk of lymphedema, how it's going to look, discomfort, and things like that. Lymphedema remains a frequent complication among survivors despite lymphatic sparing procedures such as sentinel node biopsies. Of the 61% of patients undergoing sentinel node biopsies, 5 to 7% develop breast cancer related lymphedema. So around 5 to 7% develop lymphedema. However, 1/3 of patients with breast cancer require complete axillary dissection, which is associated with 13 to 47% incident of lymphedema. So obviously, if you get a sentinel lymph node biopsy, your risk is a lot less than if you get full dissection. Breast cancer survivors at risk for lymphedema, alter activity, limited activity, or both from fear and uncertainty about their personal risk levels. I think I messed that up. I'm so tired. I'm running on very low sleep. Breast cancer survivors at risk for lymphedema, alter activity, limit activity, or both from fear and uncertainty about their personal risk levels. Oh, it's basically saying that most cancer survivors who are at risk, they either change their activity or reduce their activity because of fear that it's going to cause um, lymphedema. So they're usually advised to avoid lifting, children, heavy bags, or other objects at risk. Such guidelines is often interpreted in a manner that deconditions the arm, increasing the potential for injury, overuse, and ironically, lymphedema onset. Wow, that's interesting that they use the word ironically in a research study. Um, Adherence to these precautions may limit physical recovery after breast cancer, and for some women, results in loss of employment. Furthermore, activity avoidance may deter survivors from performing regular exercise, which may prevent recurrence and improve survival. By contrast, controlled physiological stress through progressive weight training may increase the maximum physical work capacity to the effective arm, protecting it from injury. All right. All that basically said is that women at risk for lymphedema tend to reduce their activity, and part of that fear is because they get advice from their oncologist or a physical therapist saying like, "Hey, you should you should be careful with how much weight you lift. You should be careful not to lift more than 5 or 10 pounds." That's a pretty common practice that you hear, and I'm gonna be honest, and there's faults on both sides. There's faults from the oncologist to not clear things up. And there's also, I don't know if the word is fault for the person, but I think definitely it falls on the oncologist. But I definitely think there is a misinterpretation in the understanding of what the oncologist is saying, which I would put that on the oncologist and I'll put that on the physical therapist too. So the most common numbers I probably hear is don't lift more than 5 to 10 pounds, right? And don't lift more than 5 to 10 pounds only applies right after the surgery. So you have a surgery. It doesn't matter if it's a lumpectomy or mastectomy, or it's irrelevant the type of surgery. It just the type of surgery just determines how long your recovery time is, which it could be a couple weeks to 2 months, for example. So obviously, the bigger the surgery, the more time you're going to need to recover. But let's assume it's a mastectomy, which will take about 6 to 8 weeks to recover from. Your oncologist is going to say, don't lift more than 10 pounds, as an example. That don't lift more than 10 pounds only applies to that 6 to 8 weeks. In fact, some oncologists can be like, actually, yep, you're fine to start lifting weights even 3 to 4 weeks. What they're looking for is for you not to stress the skin or the area that you had the surgery in. That's what they don't want you to do. They don't want you to lift more than 5 to 10 pounds right after that surgery period. After that 6 to 8 weeks, or once you are cleared, you have no limit. You do not have to, you know, stop moving because you had surgery. What happens is that you become fearful of what the oncologist said. You're very mindful. You just had this big surgery. It's cancer. It's anxiety producing. It's stressful. All that put together with what the oncologist said, it really stops you from moving. And that's the worst thing you want to do, because if you stop moving your arm, you're going to increase your risk of injury. You're going to increase your risk of lymphedema, and you're going to stop the motion in the shoulder. So when you stop moving your arm or your shoulder, you actually reduce the mobility and the range of motion in the shoulder. And that's where frozen shoulder comes in, where you can't even lift up your arms because the word that people use is like babying it, but you're just so scared of doing anything to it that you stop moving it, and then you get actually worse and more problems from it. So the lack of movement is actually worse than having movement on it. But to clarify, that 5 to 10 pounds is just in the time period where the oncologist says, don't lift more than 5 to 10 pounds. And that is for a brief period. It could be 3 weeks, it could be 4 weeks, 6 weeks, 8 weeks. It depends on your oncologist, your surgeon. After that, you are cleared to exercise. And if you don't, then you're going to have more serious issues because of lack of movement and because of the surgery. Now, during that 4 to 6 weeks, what I always recommend is going to physical therapy, asking for your physical therapy referral. Not all oncologists are going to give you one automatically. Just ask, be an advocate for yourself, and just say, hey, can I get a referral? They're going to be like, sure. What's it, to me to just give them the referral? Take it if you can. I believe it should be standard practice to get a referral to physical therapy right after, but it's not. So you have to ask. All right, let's go back into it. Also, sorry if I felt like, I was blaming you for anything. It wasn't supposed to be a blame. It was more supposed to be like there's a misinterpretation that's going on from the patient's kind of perspective of receiving everything because of everything that's going on. But that's not your fault. I believe that's the oncologist's fault because they need to clarify specifically when those guidelines start and end. And I also believe they should give you the referral for physical therapy because there is exercise and there is movement you can do and you should do even in that time period, working on your serratus muscles, your diaphragm, your breathing to help expand the rib cage. There's so much that you can do even in that time period where you can't lift that's actually going to help you recover faster. Let me get back into the study because I went on a side note and a tangent there. This is super important. By contrast, controlled physiological stress through progressive weight training may increase the maximal physical work capacity of the affected arm, protecting it from injury. So, keywords controlled physiological stress. When you are supervised doing a proper movement, proper mechanics, proper technique, proper programming, proper exercises, you actually see, more function and reduced risk of lymphedema. They didn't say that, but I'm giving you that little tidbit right now since I already know that. In a pilot study, we found no evidence that slowly progressive weightlifting precipitated lymphedema among breast cancer survivors. So they did a study to see if it actually increased lymphedema in breast cancer survivors, and they found that it did not. Although the study had limited statistical power, which basically mean that they didn't have enough people doing that study to say like, hey, this is something that we know. The physical activity and lymphedema trial was conducted among the breast cancer survivors to determine whether exercise is safe for women at risk for lymphedema. Women were randomized, so they did another trial. I believe this is a different trial. Or maybe it is the same one. Basically it's the PAL, the physical activity and lymphedema trial, was conducted among breast cancer to determine if it was safe. Women were randomized to a 1-year weightlifting intervention group or a 1-year non-intervention group. The PAL trial was a single study statistically powered to address two distinct primary goals. We previously published the findings of the primary goal, which was to assess the effects of weightlifting on lymphedema worsening. Herein, we report the results of the secondary primary goal, which was to evaluate the incidence of lymphedema from weightlifting from a distinct pool of the PAL participants. Oh, okay. I see what they did. Once again, I don't read these studies ahead of time. So basically, they did a study, okay? And in that study, which is actually the physical activity and lymphedema trial, they ran that study to see if weightlifting or exercise, I don't know what they did in terms of what the actual methodology was, what the actual exercise was, if it worsened lymphedema. I believe that's correct. Let me just double check here. When you're sector weightlifting, yeah. So if it worsened lymphedema, that's what that study did. Now they're looking at the participants in that study, and they ran a different analysis to see if it increased the risk of lymphedema. I believe that's the difference. So they did one study. Basically, they ran one exercise trial and they tested one thing, created one study out of it, and now they're running basically different stats and different things, different pooling, and they're going to check a different finding from that same trial. So generally in research, one study can't prove everything. So you have to do different studies to prove or show different things. In science, we don't like to use the word prove, but I'm just using that just to make a point here. Okay. So the methodology. Let's see what they actually did. Breast cancer survivors with and at risk for lymphedema were recruited. Okay. So in the research study, they actually included people with lymphedema and those who were at risk for lymphedema. So in the first study, they actually looked at the people who had lymphedema. Did weightlifting make it worse? And what they found is that it didn't. Now, in this study, I believe they're looking at the people, the women who were at risk for lymphedema. This is Philadelphia. Participants were recruited between October 1st, 2005 and 2007. Oh, something to know. The reason I bring up this whole Philadelphia is just because they did the study. But most research studies are connected to a hospital. So you might, if you are in the Philadelphia metropolitan area, you might be able to get free access to exercise through wherever they're associated with. So for right now, let me double check. I don't know if I can find it here. I believe it's University of Philadelphia, whatever they're connected to. I wonder if the hospital is somewhere around here. I can't see it. But anyways, if you look at the hospital, actually, I can't see it. If you look for the hospital in Philadelphia with Catherine Smith in it, you either A, might be able to get free exercise resources from it, or B, you might be able to enroll in exercise trials, which those would obviously be free as well. Anyways, let me just continue, blah, blah, blah. Okay. After baseline measurements that confirm whether the women had lymphedema, participants were randomized into the trial about lymphedema worsening results, of which had already been published. So they've already published whether exercise actually makes lymphedema worse in women with lymphedema. Or intro trial described herein, which evaluated incidence of lymphedema from weightlifting. So this trial specifically is looking at the women with at risk for lymphedema. How did exercise impact them? Okay. Eligibility requirements for the trial included obviously women, history of unilateral non-metastatic breast cancer diagnosis, so nobody with metastasis, diagnosis between 1 and 5 years before study. So if somebody had, 10 years, for example, if they were a breast cancer survivor after 10 years, they were not included in this study. I think the reason for that 5 years is because risk of lymphedema, I don't remember what the cutoff is, but I believe it can happen anywhere between 1 and 2 years. I don't remember off the top of my head. I definitely know up to 2 years you can have an increased risk of lymphedema. I think they did 5 just to make sure that they had enough years, enough time points to prove their study. Because if they're like, oh, well, we only studied women up to 1 year after, that's not enough time period to be like, oh, look, it actually does decrease risk. We would only know that it decreases risk up to a 1 year mark. Anyways, currently cancer free. I'm tired, so bear with me. Would limited participants in exercise. Oh, they had no medical conditions that would limit participants in exercise. No weightlifting in a year before study entry. So these are women who were not exercising, at least with weightlifting. No plans for surgery or to be away for at least 1 month during the study. Current weight stable and not actively trying to lose weight. So they were not trying to lose weight. Their weight was pretty stable. At least 2 lymph nodes removed. No prior lymphedema diagnosis. No evidence of current lymphedema. So this right here is very interesting. This line. At least 2 lymph nodes removed. No prior lymphedema diagnosis. And no evidence of current lymphedema. The reason this is interesting, and by the way, the conversation I'm having with you right now is conversations that they had too. And I am nowhere near as smart as any of these researchers. they always have a reason to pick certain guidelines. And I don't know if they're going to explain these later on. The reason I say it's interesting is because your risk of lymphedema increases with lymph node removals, yes, but you see the biggest significant increase after 5 to 7 lymph nodes removed. So, for example, if somebody comes to me and says, "Oh, I only had 1 or 2 lymph node removes," I wouldn't really be thinking about their risk of lymphedema. It would already be low. Is there a risk? Yes, but it's a lot lower than if somebody said I had 20 lymph node removed, or if they had 5. If they had 5, 6, or 7, I'd be like, all right, well, now we are actually thinking about lymph node removal here and in terms of lymphedema risk. So to include at least 2, it's good from the perspective of number one, you're getting more participants, which is, I believe, part of the reason why they would have included at least 2. But number 2 is because there's automatically a risk associated with it. I don't think 2, to be honest, is fair enough because your risk increases with more than 5 to 7. The reason I bring this up is because if the majority of the women had at least, let's say, less than 5, and this study looked at exercise risk or lymphedema risk in women with risk of lymphedema, these women already had low risk in general. So it would bias the study one way more than the other. I don't know if that made any sense. I hope it made sense, but this was interesting to see. I'm not saying that this is a bad or good study. Like I said, I did not look at this ahead of time. Anyways, for the purpose of eligibility, lymphedema was defined as an interlimb difference of at least 10% of measured by water volumetry, greatest circumference difference, blah, blah, blah. Okay, it's pretty standard. Believe there's certain people that count it at less than 10%. I don't know. But this would be a good marker, by the way. Women with suspected lymphedema were sent for evaluation with the certified lymphedema therapist to be verified. Good. So this obviously means that the women did not have lymphedema. And if they did, then they would be viewed by somebody who would actually know to diagnose them. So that's perfect. All right. So these little figures here are not super important, but I had a professor teach me how to look at these better, and I thought it was interesting. He made it a little bit of fun. So let's see if I can do the same. So we had 3,200 women assessed for eligibility. Wow. So they had a lot of women who were assessed. 3,000 of them were excluded. That's insane. So that only leaves it with 200. Did not meet the inclusion criteria for breast cancer related lymphedema, declined to participate. Wow, so that's 900. Oh, sorry. Yeah, 999 women decided not to participate in this study. This is why I say this is important. If you get an opportunity to, do and be part of a study, please do it. There's 999 more women who could have gave us some more information on what it is that we're finding here. And obviously everyone has their own reason, but if you ever can, please do so. Anyways, we're left with 154. So they were randomized. One woman went to the weightlifting group. The other women did not. Okay. Out of those 77, 6 lost to follow-up, 5 recurrent disease. Okay. Included analysis, inclusion. Okay. Whatever. Women were placed into 2 equally sized groups through a computerized process called minimization in a manner that was unpredicted and concealed from results research staff. Basically, what they like to do is they put, let's say your name into a database, and then the computer randomizes people, so there is no risk of bias, essentially. So, for example, if I'm the researcher and I know that you like to exercise, as an example, then I might be more in tune or biased to give you or to put you into the exercising group. And then that would bias the results. Instead, we take that away by putting you into a randomized, computer to help you choose which group do you go to. So that way it makes it even on both sides. Okay, intervention. All right, intervention. And the weightlifting group received 1 year membership to community fitness, usually YMCA, nice near their homes. This is one of the nice things about these big research trials. Catherine Smith is a part of these big trials. They get a good amount of money, so you get some gear, some exercise equipment, a freaking 1 year membership to a YMCA near you. That's insane. There's a study that people got received free treadmills. Can you believe that? Treadmills are like $2,000 a pop. Imagine receiving a free treadmill. Anyways, for the first 13 weeks, women were instructed twice weekly on safe performance of exercise in groups of 2 to 6 survivors. Certified fitness professionals employed by the fitness center led these 90-minute sessions, so they always want certified people. Upper body exercises was seated row, supine, dumbbell press, lateral and front raises, bicep curls, and tricep pull downs. So they had a pretty normal weightlifting routine. You know, your dumbbell press, your seated rows, a little bit of shoulder work, triceps, perfect. Were performed with dumbbells or variable resistance machines. Great. Lower body exercises, leg press. I hate the leg press, by the way. Don't ever use the leg press. Back extension, it's okay, I guess. Leg extension, nice, and leg curl were performed with variable resistance. Listen, the leg press is one of the reasons you can't grow your legs as much, by the way. It's very hard to fit in for most people. It doesn't give you the range of motion you're looking for. This is more of a hypertrophy, muscle building, and muscle strength conversation, not a lymphedema conversation. But if you can, just avoid the leg press. Very few people does it actually work for. Anyways, specific equipment used varied across the fitness, blah, 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 blah. 3 sets of each exercise were performed at each session, 10 repetitions per set. If you're doing 3 sets for 10 reps, you're going to be pretty sore the next day. So they probably did lighter weights, by the way. Um, but 3 sets for 10 reps would give you enough stimulus to actually get a good workout in. Normally, I recommend start with 2 sets at a moderate weight. So that way you're not, too fatigued doing the exercise. This is not bad. I'm just giving you more tips so you can be more successful. After 13 weeks, participants continued twice weekly, unsupervised to 1 year. So they had supervision the first year. So for my online coaching clients, I literally supervise everything. I check their reps, their sets. I give them the program. I show them exactly what technique I want them to use, what weights I want them to use, what machines I want them to use, how much time to rest, because they need to be doing everything. Everything's designed to give them the best outcome, right? So basically, after the 13 weeks, these participants said, hey, go be free, be wild, right? Weight was increased for each exercise by the smallest possible increment after 2 sessions of completing 3 sets of 10 reps with no change in arm symptoms. So basically, a common question I get from my online coaching clients is, how do I know how much weight to increase? In this study, for example, they just increased the small, once you could get 3 sets of 10 reps. So let's say you grab the 10-pound dumbbell as an example, and you're doing bicep curls with 10 pounds. You did 3 sets of 10, and you can achieve 3 sets of 10. The next time you go up to 12 pounds and you try to do 3 sets of 10, and you don't change the weight until you could do 3 sets of 10 with that weight. However, 2 sessions. You want to make sure you can complete 3 sets of 10, 2 sessions in a row before you go up in weight. Fitness trainers called women who missed more than 1 session per week through the year. So basically, you had somebody there motivating you. Participants who missed more than 2 consecutive sessions were asked to reduce resistance and rebuild as per protocol above. So something that's important, if you basically miss your workouts, you don't want to just jump back into exactly what you're doing. You want to just decrease a little bit. Go down to 2 to 5 pounds. That's more than enough to get you a little bit of baseline and recovery time, so you're not too sore jumping back into it. Participants in the control group were asked to not change baseline level of exercise during the study and were offered a 1-year fitness membership with 13 weeks of supervised instruction following the study completion. So this is awesome, by the way. This is really, really cool to see. So first of all, if you landed, let's say you're somebody who loved exercise and then you landed in the control group, that means you do not get to exercise during that time period, which sucks. But you can really tell the PhDs, the doctorates who truly care about the participants because of what they do for the person in the studies. So I got the privilege of working with some incredible doctorates and researchers. And I was absolutely stunned and amazed by how they treated the participants in the study. And to give the control group, uh, 1 year membership just for being part of the study and 13 weeks working with like a personal trainer, it's just a huge gift. They don't have to do this, by the way. They chose to do this because they care about the people who are in the study. That's incredible, and that says a lot about them, by the way. This just kind of goes to show the type of people running the study. But this is not something that they have to do. They just get to do it, and they wanted to bless the participants. Anyways, all trainers who worked with the participants underwent a 3-day training course, including the exercise protocol and an overview of lymphedema prevention, symptoms, and treatment. This is really, really good that they had a training program. You want to work with somebody who knows what they're doing, not just any random trainer. An intervention coordinator met with trainers weekly during the first 13 weeks, then monthly to ensure protocol fidelity, blah, 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 blah. All participants, weight lifted interventions and control groups who developed lymphedema were provided a custom fitted garment. Nice. So they were given a compression sleeve. Definitely work out with your compression sleeves. Were required to wear the compressions during weightlifting sessions. Trainers asked about changes in symptoms weekly and took circumference and water volume to see essentially if they had any changes. Anyways, in addition, all participants, weightlifting and control groups were required to attend a 1 hour educational lecture about lymphedema. So, this is super important to know. You want to learn as much as you can. And this is why working with someone who knows what they're doing is so important. So, for example, for my online coaching clients, it's not just here's your program and then go be free. It's here's your program. If you have any questions, I'm here to answer you. I'm here to check in to make sure that you're actually following it. If you're not, then I get to tell you, hey, what's going on, right? And make sure that you're staying motivated and hold you accountable. But it's not just that. I'm also sending them basically weekly tips and information that they need to know to improve their life, to improve their health as much as they can every single week. So you're constantly getting or they are constantly getting information on how to improve their health. And the most common thing I hear is, I never got this during cancer treatments. Nobody ever gave me this or explained this to me after, my chemo treatment was over. So getting the information that you actually need is extremely important. So I love that they had a 1 hour educational lecture on how to reduce lymphedema, treatment for it, exercise safety, things like that. Anyways, measurements at baseline 12 months were completed by trained staff. So essentially they had, a pre and a post test, which is pretty basic. I'm not going to read all of this because, oh, that's what it was. A 5% or more increase in arm swelling was defined as lymphedema onset. So whenever you had a 1% or 5% or more increase, that's basically what they would define as essentially lymphedema. Anyways, I'm not doing this. I'm not gonna read this. Let me see if there's anything else I should read. I wanted to see their. Do they not have the table here? Where's the table? Let me see if I can find their table. Strength, diet. Where's table? Okay, here it is. Characteristics. Thank you. So let's look at the people who were in the study. The median age, I think this is standard. Yeah, the median age was 54. So these are women in their 60s, in their 50s, by the way, between call it 47 to let's call that 62, 64. So between 40s and 60s, most women were in their 50s though, mid 50s. About half had college education or more. Most of the women in this study were white. Um, I was trying to give a statistical number to how many of them were white, but I couldn't figure that out. This gives me their work. Most of them were working. Okay, here it is. This is what I was looking for. So, cancer stages. The majority had stage 1. Very few had stage 2. And then about 25 women had stage 3. So notice there is no stage 4 in here. But the majority of the women here had stage 1, which probably means that most of them had like a lumpectomy, potentially. Number of lymph nodes removed. On average, they had 8 and 9. So this lets me know that on average, most women were at risk for lymphedema. On average. I wish I knew what the numbers were, but that's okay. Most of them received chemotherapy. Most of them received radiation. Many of them were on tamoxifen. And not many of them were actually on a hormone. There was no difference between the control groups there, or the two groups. Now, let's look at how they did in terms of their exercise. Oh, I don't know if you can see this. Let me make sure that you can see this. You can't see it too well. All right, let me see. I don't think you can see it that well, but that's okay. I'll try to do my best here. So we have baseline, and then after 12 months, at baseline, it looks like there was no difference in strength. Yeah, no difference in strength. No difference in weight. No difference in body fat percentage. No difference in fat mass. So there's no difference between the two women in either group. One group did not have more muscle, one group that did not have more fat, one group that was not more active. Both groups were pretty much the same. Most women were overweight. Most women weighed, call it, between 150 to 170 pounds. I had to turn kgs into kilograms. Sorry, kgs into pounds right there off the top of my head. Call it 150 to 170 pounds, somewhere around there. Most women had around, call it 90 pounds of muscle, and oh my goodness, there's a lot of conversions in my head. Maybe 60 pounds of fat. So, oh yeah, that puts me right about what I said. So around 150, yeah, 150, 170. Anyways, there's no difference between them. Their physical activity wasn't any different, and their nutrition was not any different. Now, let's look at the women who exercised after the 12 weeks compared to the ones that didn't. There was a difference in their strength. Go figure. So the women who exercise, improved their strength, and there was a significant difference. Strength in their arms and improved their strength in their legs. Woot woot. 0.1 for exercise. The women who exercised versus the women who did not exercise weighed the same. There was no difference between the two women. Okay. And their BMI did not change. Let's look at this. I think there is a change here. I can't really tell. The women who exercise, let me double check. I'm looking at the very small picture here. Lost body fat. And there was a difference. Significant difference. And when I say significant, I mean statistical. If you probably lost this much body fat, you might be upset because you would think, oh, but that's such a small percentage. They essentially went from Oh, okay. I'm gonna have to open this up because I can't see that well. I hope you could see this. All right, so this is what I'm trying to show you here. So we got body fat percentage. They started off at 37. This one's 39, and they ended up at 37.34, and this one's 39.54. Now the p-value shows that there's a difference between these two groups. I believe that's what it shows. The p-value shows that there's a difference between these two groups. However, the difference in between the person, they didn't really drop that much body fat. So it's more statistical than like impressive actual difference. Now let's look at the body fat here in kilograms. This is an example of what I was saying. For example, the women who were weightlifting, they started off with 28 kilograms. So to give you an example, I'm going to actually use my calculator here so I can give you some concrete numbers for those of us who use pounds. So they used 28 kilograms. So they had 28 kilograms of fat, which is 60 pounds of fat. So they had 60 pounds of fat on their body as an example. To be exact, it's 61.6 pounds of fat. And they dropped to 27 kilograms, which is 59 pounds of fat. So 61.6, I believe, is the number. So they dropped 2 pounds of fat, which, by the way, is phenomenal. If you lose 2 pounds of fat in 12 weeks, you did incredible, because we're not changing calories here. They literally just lost fat from exercise alone, which is really, really good. Now, in lean mass, which is the important one, they started off, the women who were exercising, they started off at 46, kilograms. At 2.2, that's about 101 pounds of muscle, and they ended up at, it's irrelevant. I could just look over here. They didn't gain any muscle, by the way. The women in this group only lost fat and didn't gain muscle. So in 12 weeks, they did not gain muscle, but they lost 2 pounds of fat, which is incredible. It's very, very hard to gain muscle. And by the way, this was not a muscle building protocol. To build muscle, you would need a different protocol. And this was not a good protocol for building muscle in terms of like a quality protocol. Like I said, take away that leg press. Anyways, so it's pretty impressive. Like I said, 2 pounds of losing fat in 12 weeks is really, really good. Now, table 3 shows lymphedema onset at 12. Oh, am I messing this up here? Did I say 12 weeks? It's 12 months. So after a year, I am so sorry. I've been saying 12 weeks. This is 12 months. Wow. So this was a very, very bad weightlifting protocol for muscle. This goes to show you that you actually need to follow the right program to actually build some muscle, because you can see muscle growth in a year. Like, you should be able, in a year, to give you an example, you should be able to see 2 to 4 pounds of muscle. If you follow the correct protocol, you should be able to see 2 to 4 pounds of muscle in a year. So, for example, I had a client. We worked together for a year, and she built, so she was in her late 60s. She was 66, breast cancer survivor with lymphedema, whose lymphedema actually reduced. So the training program actually reduced her lymphedema significantly, by the way. Her lymphatic therapist, physical therapist, was shocked at how much it was actually able to reduce. She lost 2 pounds of fat and gained 1.5 pounds of muscle in 6 months. So she saw significant improvement. Let's compare that to most women in this study who lost, 2 pounds in 12 months and did not gain any muscle. So, anyways, you can actually, following the right program, you can actually see some better improvements than this. Besides the point. Sorry, I don't know if you got to see my dog, but his breath stinks and it just hit me right in my face. Anyways, so the lymphedema onset after 12 months, the proportion of women who experience a 5% or more increase in inner limb volume difference during the 12 months was 17%. So 13 out of 75 in the control group. So let's stop real quick. Within a year, let's say you did not do any exercise. 13 women experienced some lymphedema out of 75. Within a year, you didn't exercise, you didn't do anything. Within a year, 13 out of 75 experienced some lymphedema. Now, 11%, so 8 out of 72 women who weightlifted, I believe, experienced some lymphedema. So risk of lymphedema dropped from 17 to 11% in the intervention group. Okay. The difference between the two was significant, statistically significant. Okay, so among the 134 women at risk for lymphedema who had no new or recurrent cancers and not lost to follow up, there were 4 incidence cases of clinical defined lymphedema, 1 in the weightlifting group and 3 in the control group, producing a CRE of 0.34. Okay, so when we're talking about, let me back up a little bit. Proportion of women who experienced a 5% or more increase in inner limb volume difference. So what it's saying here is that 5%, let me go back. 17% of them, so 13 women, experienced an, let's call it like a mini lymphedema incident where their fluid in their body was not going through the rest of the body as it should. So lymphedema is essentially where your fluid gets stuck in your body because you don't have enough pressure to help it flow. And the reason exercise is so impactful is because every time you move your muscles, you're actually helping pump the fluid away from the stagnant area. Imagine you just have puddles or holes, literal holes where the fluid gets stuck and the fluid is not flowing through. So every time you pump, it actually moves the fluid throughout your body. So basically 17% of women experienced that when they didn't exercise, they were more fluid buildup compared to the women who exercised. They did not experience fluid buildup as much. Only, what was this? 11% did compared to nearly 20% of women. Okay. Now, when they actually looked at the women and they actually looked at clinically defined, there were 4 incident cases of clinician defined lymphedema. So this was 4 cases of women who actually got lymphedema. And remember, there's standard for, hey, you just had some fluid buildup compared to you actually had lymphedema, which is it's just stuck, right? One is just a buildup that kind of is transient, it kind of can come and go. The other one is just stuck there. Okay. And there was basically 1 in the weightlifting group. So 1 out of what is that, 72? And then 3 in the women who did not exercise. Meaning that in terms of like actually giving you lymphedema, whether you lifted weights or whether you didn't, there wasn't a difference. Like actually giving you lymphedema, weightlifting did not actually increase the risk of getting lymphedema. There was no difference between the group. However, the women who did not exercise, I can almost guarantee you they had a greater fear of having lymphedema because they had more onsets. More women had like, oh my gosh, I have this fluid buildup happening. Right now, the good news is that they were in a study that they could be like, hey, no, you actually don't have lymphedema. This is just like, a little bit of fluid buildup and they can continue on with their lives. But the women who did not exercise actually experienced more of that fluid buildup compared to the women who exercised. They had, there was a less women who experienced like this fluid buildup. Anyways, this is great news because, the women who exercise had less fear associated with exercising, because they had less symptoms of it. But it also showed that exercising did not even increase the risk of lymphedema. And the one person that, lifted weights and got lymphedema, it wasn't because of the weightlifting. It's just, Not the best luck. Let's just put it that way. I don't know on that one. I don't know how many lymph nodes she had removed and different things like that. But anyways, we know that the weightlifting did not cause lymphedema, which is good to know that you can actually lift weights and you don't have an increased risk of lymphedema. Okay, this is great. So participants who had 5 or more lymph nodes removed, defined by the greater 5% increase in arm swelling. Clinicians base. Okay. Participants. I'm trying to understand this table here. Participants who had more than 5 lymph nodes removed. Remember, more than 5 means that you are at an actual risk of lymphedema or a significant risk. I really wish they gave me the total numbers. I thought this was something else. I thought it was going to give me the total numbers between how many of them actually had more than 5 lymph nodes removed. But this is showing that weightlifting intervention, that 3 out of 45 had an increased, 5% in arm swelling. So what they're saying is that there was, oh, I could probably run the numbers here. So this is actually pretty good to know. Um, Sorry, I just got a text message from a client there that was saying that their arm swelling has actually gone down and it feels better from the exercise. So that they're doing some. Oh, that's exciting. He's exciting. He's been doing some fishing and his back and his arms feel great from the exercise. Anyways, let me get back into this. I'm so sorry. Okay, so they had 72 women in the exercise group, and there was 45 of them who actually had more than 5 lymph nodes removed. So let's go 45 divided by 72. So about 60% of the women were like at a significant risk for lymphedema, which is good. I would have liked to see that number be higher, but this is still good. It's not a bad study. However, I would have liked to see it higher. Now, out of those 45 women, only 3 of them. So remember, more than 5 lymph nodes removed is a significant risk for lymphedema. Only 3 of them had, that mini fear, or I don't want to say fear, mini onset of lymphedema or arm swelling, compared to 49 women who had more than 5 lymph nodes removed, which is a significant increase in lymphedema risk. 11 of them had that arm swelling pop up. So there's a big difference between the two. Huge difference, which is very, very important to know. Okay. That exercise, the women who exercise, most women had less risk of having any symptoms of just fluid buildup. That's phenomenal. Okay. Now comments. Let's go to the comments. We're almost done here. I hope you've enjoyed it so far. Breast cancer survivors who perform slowly progressive weightlifting twice a week for 1 year were less likely to experience clinically significant increase in arm swelling than women in the control group. The majority of clinically significant increase in arm swelling in women in the control, the majority of breast cancers do not have lymphedema. However, they alter the use of their arms and upper body activities out of fear of developing lymphedema. Okay, the findings from our trials should help clarify clinical advice. Basically, start slow. You can stress your body and work with somebody who knows what they're doing. Prior randomized trials of weightlifting safety among breast cancer survivors, all of which agree with the current findings. So basically, we know that from different studies that exercising does not increase risk of lymphedema, and it may actually help prevent it, which is extremely important. Our studies is the first well-powered clinical, basically saying that they had enough people in this study to show that there's no increase of lymphedema risk with weightlifting alone. So extremely important to know. You can lift weights even if you've had lymph node removed. Even if your oncologist said, you're at increased risk for for lymphedema, you are safe to go exercise. In fact, you potentially have a less risk of developing lymphedema as long as you're doing it safely, progressively, and correct. All right. So I hope this was helpful. And let me just make sure second participants started training at 1 to 2 pounds and progressed. Uh, training started training at low weight 1 to 2 pounds and progressed resistance according to symptoms. So most women in the study actually used 1 to 2 pounds to start with, by the way, and then they just increased. So that means they didn't just stick with 1 or 2 pounds throughout the whole year. They actually increased weight. I wish I had seen how much they ended up lifting. So let me go back to the okay, here it is. So for example, most women were able to lift 40 pounds, okay, when they first started. By the end of the intervention, their strength increased and they were able to lift 54 pounds, which is a pretty big difference with their chest. So this is after breast cancer, by the way. So you are able to do chest exercises. And then the leg press, they started lifting 170 pounds with their legs, which is awesome. And they went up to 213 pounds. Great job, ladies. That is phenomenal. Meanwhile, the women who did not exercise, ooh, this is interesting here. The women who did not exercise, let me see here, did not increase any strength. I actually thought they lost strength, but they didn't. Which is interesting to see because if they weren't exercising, you should have seen some loss in strength, but it doesn't look like there was any loss in strength actually. For legs or for arms, but the women who exercised did see some improvements in leg and arm strength. So I hope that was helpful. Once again, I'm JC. I'm a clinical exercise physiologist. If you haven't seen my channel, if you have, I hope you got some value from it. If you have, please subscribe.